Valen. I'm going to be your nurse today.
Alright.
Can you state your name and date of birth for me?
Michael Butler, August 22nd, 2000.
Perfect. And what brings you in today?
I have chronic chest pain.
Okay. Can you explain the pain for me? Is it a burning pain, sharp pain?
It's a sharp pain.
Okay. And when did this start?
About like 2 weeks ago.
Can you show me where at on your chest you're feeling
Yeah,
it?
it's like right here.
Okay, perfect. On a scale of 1 to 10, what would you rate that pain?
An 8.
Okay. Is it intermittent or consistent? Like you always
Intermittent.
intermittent? Okay.
Yeah.
And what makes it worse or better, do you think?
Like standing up and stretching helps a little bit, but as soon as I sit back down, it's just as bad.
Okay. And do you have a cough with it or a fever or anything like that?
I have both.
Okay, both. Okay. So I'm going to ask you some questions. Do you have any personal or family history of nose or sinus problems or trauma?
Nope.
No. Any discharge or sinus pain?
Nope.
Altered smell or taste?
No.
Self-care methods, do you use anything to make the pain better? Do you take over-the-counter medication?
No.
None of that? Okay. Do you have family history of lung problems?
Nope.
You said you had a cough. How often do you think this cough occurs?
Probably like a couple times every like minute.
Okay. And do you have any shortness of breath?
No.
Okay. And you have pain with coughing, breathing, and smoking, you said?
Correct.
Okay. Do you have any environmental exposures to chemicals, mold, anything? Okay. Do you know when your last TB test was?
I do not.
Do you know when your last chest x-ray was?
No.
Okay. All right. So, do you know where we're at right now?
Yes, we're at the Cincinnati Medical Facility.
Okay. Do you know what month it is?
November.
Okay. From this, I can tell that my patient is alert and oriented times 4. Do you have any allergies that I should be aware of?
No, I do not.
Okay. On a scale of 1 to 10, with 10 being the worst, what would you rate your chest pain?
An 8.
Okay. At this time, I would perform vital signs on my patient, which includes temperature, heart rate, respirations, blood pressure, and oxygen saturation. All are within normal limits. By looking at my patient, he appears his stated age. His skin color is even and appropriate to his ethnicity. His facial features are symmetrical. He has no signs of acute distress. Posture is upright and symmetrical. Height and weight are appropriate to body stature. He articulates clearly, well hygiene, hair looks clean, dressed appropriate for the weather. So now I'm going to be performing a head to toe assessment. We're going to start at your head and we're going to go all the way down to your feet, okay?
Okay.
All right, so we're going to start with your head. We're going to feel around. No lumps, lesions, or infestation. Shape is normal cephalic. Now we're going to be looking at your eyes. Pupils are round and equal. Both eyes react to the light. Accommodate bilaterally. So now I'm just going to pull down on the lower. Conjunctiva is pink and sclera is white. Perfect. Do you wear any hearing aids or are you exposed to loud sounds at work or home?
No, I'm not.
Okay. Just going to take a look in your ears. No signs of redness or drainage in the ears. Patient does have ear piercings on both ears. Or you can't see me. Is there any pain with that?
No.
No. Okay. No skin breakdown behind the ears. Could you tilt your head back so I can look at your nose? No signs of redness, drainage, no signs of a deviated septum. Have you had any surgeries or nose trauma?
No, I have not.
No. Okay, could you cover one nostril, breathe in, and then the other side? Okay. Patient's nares are bilaterally patent, which means he has a good airway. Now we're going to test range of motion. Could you scoot over a tiny bit for me?
Yes, I can.
Okay. Now we're going to test range of motion on your neck. So could you look up for me, down, side, side. Okay, patient has full range of motion in his cervical area. Now we're gonna test for carotid pulse. +2 bilaterally. Now we're going to auscultate for any bruits. No bruits noted. And then we're going to go back to the mouth. So can you open your mouth and say ah? Okay. Mucous membranes are moist and pink. Uvula falls and rises midline, and lips are pink and moist, and teeth are intact. So now we're going to be assessing your lung and heart sounds.
Okay.
So I'm just by looking at you, doesn't have any labored breathing and isn't using any accessory muscles. So I'm going to listen to 6 different places on your front and then 6 on your back. And if you could take a deep breath in with every...
Okay.
And then your back side. Okay, lung sounds bilaterally are clear, no adventitious sounds noted. Now we're going to be listening to your heart sounds.
Okay.
So you can breathe normal for this one. Okay, S1 and S2 are regular, no extra heart sounds or murmurs were heard. Now we're going to be assessing your skin. So skin on the arms and skin on the legs. Skin is warm and moist with pink undertones. No tenting present, no lumps, lesions, scars, or tattoos present on the upper or lower extremities. Now I'm going to be assessing radial pulse on both arms. Okay, so +2 bilaterally. Capillary refill on the upper and lower extremities, less than 2 seconds. Just by looking at the fingers, they're short, round, clean. Can you go like this for me? No signs of clubbing of the nails. Now we're going to be looking at your apical pulse. So if you could go ahead and lay down for me, I'm going to be auscultating your apical pulse for 1 full minute. Apical pulse is 85 and regular. I'm going to inspect the abdomen. Just from looking, the patient's contour is rounded to flat. Umbilicus is midline, and no signs of pulsations or hernias present. Now I'm gonna listen to all 4 quadrants and make sure there are active vowel sounds in each quadrant. Patient has active vowel sounds in all 4 quadrants. I'm gonna palpate. Is there any pain with that?
No.
Patient does not report any pain or tenderness on palpation. I'm going to be looking at your pedal pulse now. +2 bilaterally, and your posterior tibial pulse. +2 bilaterally. And then if you could go ahead and put your knees up for me, lay back down and put your knees up. Just gonna check for edema. No edema present on the lower extremities. Could you go ahead and here sit up for me? We're gonna test your muscle strength now. If you could put your arms like this, you push against my hand, away, towards me, up towards yourself. Okay, same thing in your legs, towards me, away, away. Okay, patient has 5 out of 5 muscle strength on upper and lower extremities. Now if you could just stand up, and I'm gonna have you walk across and then walk back for me. Okay, patient has steady gait and normal balance. And that concludes the head to toe assessment.